Good afternoon and welcome to the Safe Streets Coalition. We're glad you chose to join us today, either by Zoom or by phone. Of course, due to COVID, we are still using Zoom to present information to you. And as we do every month, a YouTube link and survey will be sent to you in just a few days. The PARS Safe Streets staff joining us today are Mandy Shakansky, Executive Director, Maddie Timish, Community Education and Media Specialist, Lynn Smith, Community Prevention Consultant, Irene Caballero, Contract Coordinator and Bilingual Community Mobilizer, Michelle Bose, our Consultant, and I'm Judy Wilson, Office Manager and National Night Out Program Coordinator. Please contact any of our staff by email if you have questions or need assistance. The agenda for today is published just for your information, so you'll have a record of it, especially by YouTube. And today we do want to extend our gratitude to our first responders. You know, we normally have a champion of character, but we sometimes miss thanking our first responders for all their hard work. So today we do want to honor our Topeka Police Department, Topeka Fire Department, Shawnee County Sheriff's Office, and American Medical Response for their service to our community. At each meeting, we normally recognize a champion of character, and of course, a person can be nominated by exhibiting good character that has significantly improved the health, safety, or quality of life of the community. Any of the 49 different qualities can be considered for a champion of character. Anyone in Shawnee County can be nominated by completing the nominating form and emailing it to jwilson@safestreets.org. And the nomination form can be found on the PARS website at parstopeka.org. The main minutes are shown, and they were emailed to everyone, so no action is taken. But again, we just want to make this a record for you so you can look it over a little bit later. We do have our Safe Streets program report in front of you. For our neighborhood crime prevention initiatives, we did have a new neighborhood watch meeting in Oakland. So we had 16 people attending the first meeting, and we have another meeting scheduled for them in about 2 weeks to get them up and running. Our safety information, of course, is mailed now to 143 neighborhood watches, and also our NIAs. We provide all this information by email, and we do have a lot of phone calls too, and we're reached that way. So far we've reached 6,272 people in the month of May. The information is also emailed to our Safe Streets Coalition members, City Council, County Commission, police officers, and others who requested. And there again, 3,042 people were reached. Normally we do have a retailers IFO meeting in person, but right now we are doing it by email. And we reached 268 people during the month of May for the retailers and IFO. Going down to our media, we have a lot of new information on our Facebook pages. So on the Lock It, Remove It, or Lose It, which is, you know, remove things from your vehicle so they won't be stolen, we reached 133 people. National Night Out, we reached 221, and it's up and running now because we are going to have our National Night Out on August the 7th, and we do have a lot of people now that are registering, and so we're looking forward to seeing a lot more there. Our Safe Streets Coalition information is posted on our Facebook, and we do have reached 168 there. As I mentioned earlier, we do have a lot of emails and calls for services. So just for the month of May, I have reached or called 582 individual emails or calls for service. You might want to look to on the substance abuse initiatives because we do have a substance abuse task force and we had it by Zoom. There were 9 people attending that. Then our media, which would be the Prevention Resiliency Services, or PARS Facebook, we had 21,227 people reach there. So that's improving too. We have a lot of good information out there for you. So be sure and check that out. On the Latino initiatives, there was one presentation, Topeka Nutrition, and they're restarting that group now, and there were 7 people attending that first meeting. There are quite a few people also that are looking on the Latino Facebook page, and we had 840 people that were reached there. So check all these out. We do have a lot of good information out there for you. Today we have Sergeant Mike Burns with the Topeka Police Department, and he'll give us an update on some crime stats. Mike?
Thanks, Judy. Sergeant Mike Burns with our Community Policing Unit for Topeka Police Department. And we'll get started with the violent crime statistics. As you can see, from the month to month, we are kind of starting to get into the summer months. And so typically, historically, we start seeing an uptick in reported crimes to us. But still, we're doing a pretty good job so far this year at keeping our violent crime statistics down. Go to our next slide, Judy. And then property crime across the board had been looking pretty good again. As we start getting into our summer months, we're going to anticipate that to increase a little bit. I do want to touch on vehicle thefts as that continues to be a problem. And there's a couple things our community members can do for that. So when a crime is committed, you have to have a target for the crime. You have to have the desire to commit the crime. Then you have to have the opportunity to commit crime. If those 3 elements are there, then an individual may commit that crime. So our community members are not going to be able to help somebody not have that desire to commit the crime. But what they can do is what we call target harden their own property, and then try to limit the opportunity that individual has to commit that crime. So when we're talking about vehicle thefts, we kind of go back to some crime prevention through environmental design, CPTED ideas. You know, if your vehicle's not in the garage, but in the front, how's your lighting of your house? How's your vegetation around the house? Is it dark? Is it concealed? Is it not out in the open? And those things people can do at a very limited cost to them. Another item that we constantly see is that people leaving their cars running in the morning. It's still going to be a little bit cool out in the morning, so we do see people that leave their car running in the morning to get warm, and then they're in the house for another 5 minutes. They come out and then they see their vehicle has been stolen. So we really want to stress that not to be doing that in the morning. Don't leave your car running in front of the quick shop just to get in and get an item, because we do see that occurring as well. Next slide, Judy. So we participated in the torch run. It was pretty rainy that day. Unfortunately, our Special Olympic athletes were unable to participate in this event, a lot due to COVID-19 concerns. But we had a great turnout anyway, later last month. Next slide. So just our upcoming June events. So Friday, June 4th is the Call Valley Bank Noto party from 4 p.m. to 9:30 p.m. We will have officers at all these events. So if you do see us, just come say hi. Saturday, June 5th is the Special Olympics track and field event. That will be out at Shawnee Heights from 9 a.m. to 3 p.m. That one will have athletes for our Special Olympics for the first time in almost 2 years. So they're really excited to get out and about on that. There's a doggy day night out at Evergy Plaza from 5 p.m. to 7 p.m. that day as well. Myself and Officer Cavanis will be out there with Magnum. On Saturday, June 12th is Tap That Topeka. It's supposed to be from 3 to 7. Sometimes that bleeds over a little bit, so we'll probably be out in the area until 9:30, and that also correlates with the second Saturday summer concert series outside the Celtic Fox downtown, and that's scheduled from 5 p.m. to 1 a.m. So we'll also be at that one. And then, of course, at the end of the month, June 24th through June 26th is the Country Stampede, and you will see a large presence of your city services county services all out there. So if you see us out there, come say hi. We'll have plenty of time to talk to you, and we're looking forward to all these events. Thanks, Judy.
Thank you, Mike, for bringing us up to date.
Yeah, and then of course we do have to end with the lock it, remove it, or lose it, because we still stress not to leave your firearms in the vehicles. They are not a gun safe, and we just continue to have calls reference somebody breaking into a vehicle and stealing firearms. Thank you, Judy.
Thank you. You know, as we touch on this lock it, remove it, or lose it, it seems like that people are doing a little bit better about not leaving purses, billfolds, money, and all that sort of thing in the vehicles, you know, like even laptops. So I think that helps our crime a lot, doesn't it, Mike? Thank you so much.
It does. And as we get.
Go ahead. Okay.
You're absolutely right, Judy. And as we get into our summer months and the daylight hours extend a little bit, we just want to make sure that even when you get home, it's still going to be light out for a while, that whatever we're taking home with us from work, that gets into the house in a timely manner.
Thank you. Next, we have a Shawnee County Sheriff's Office Deputy Abigail Christian, and she'll give us an update on the Sheriff's Office.
Thanks, Judy. Like Judy said, my name is Abigail Christian, and I am the Public Relations Deputy for the Shawnee County Sheriff's Office. We'll go to our first slide. First, we're just going to look at some of our stats. As you can see, so far in 2021, our burglary and theft cases are down, which is great. And again, we can attribute that to our vigilant citizens that are continuously calling in suspicious activity, and then just our proactive policing that we are happily doing every day out there. Go ahead and go to that next slide, please. Our methamphetamine arrests are up. This is great that we are continuing to get this drug off the streets, and we just continue to ask for everyone's help, and we'll do our part in getting it off the streets. And then we encourage everyone to seek out resources if they do have a drug problem or know somebody that does. There are a ton of resources in our community. Next slide. And this one, our arrests for felons in possession of firearms. Again, this just comes from calls where we arrest individuals and find out that they are not eligible to have firearms. So we will continue doing that as well. And we can move on to the next slide. A lot of those firearms that we seize right here, you can see our numbers are going up. We've got 19 for the year. A lot of those firearms are illegal firearms that are stolen from cars. So like our partners over at the Topeka Police Department said, lock it, remove it, or lose it. Make sure we're not leaving those firearms in vehicles or places that can easily be stolen. And next slide. All right, so summer's here, school is out. We just want to share a few tips with our parents. Ask that you please talk to your children about the following topics. First, always keep a close eye on your kiddos and talk to them about safety in and around water, whether that be pools, lakes, rivers, etc. Make sure that you are practicing and preaching about safety in the water. Talk to your children about stranger danger and all the dangers that come associated with strangers, whether it's online, in person, over the phone, whatever it is. Just talk to them about notifying you when someone they don't know contacts them. Next, we ask that you explain to your children what to do if they become lost or who they can seek out for help. We encourage children that if you lose a parent, whether you're out in public or maybe like at a park, grocery store, that kind of thing, look for a law enforcement officer in uniform to help you, or a mother with children is usually a good person to go to help find your parents. Next, we encourage you to tell your children what to do when they're home alone in regards to if someone comes to the door and tries to talk to them, or if someone calls and asks if their parents are home. Just kind of go over what you would like your children to say and do in those situations. And lastly, encourage your children not to be afraid to ask or even yell for help should they need it, whether that be in public, for whatever circumstance. Make sure they are comfortable asking or hollering for help when it's needed. And this last slide here, recently we've had several burglary calls that we have been dispatched to that initiated from citizens calling in when someone either got into a vehicle or got into a shed, and they were able to give us enough information about either the people or the person that was in there or the vehicle they were leaving in. And our deputies were able to quickly get to the area and find that car and make some pretty good arrests. So we continue to thank our citizens for calling in suspicious activity. Feel free to call 911, or if you just have information on suspicious activity, you can call our non-emergency number as well. And we appreciate the community working together to help us keep everyone safe. And as always, tune into our social media. We try to keep it as up to date as possible with information about what we're doing and what's going on. And if you have any questions, do not be afraid to ask. Thank you so much.
Thank you, Abigail. These are all really good tips, especially we do talk to the neighborhoods when we go out and do neighborhood watch. You know, be sure and be aware of who's in your neighborhood that shouldn't be and what to list to give to the law enforcement to try to help catch these people. So thank you so much. Mandy will introduce our speakers.
Sure. Thank you, both Sergeant Burns and Abigail, Deputy Christian, for your contribution. We really appreciate it, and great information that you shared with us today. My first role today is to introduce City Councilman Tony Emerson. He represents District 4 in our city. He currently serves as chair of the Finance and the Transient Guest Tax and Policy Committee. He serves as well on our JADO committee. He owns his own company, MCON, which performs heavy and highway and underground utility projects. He and his wife, Allison, have 4 children that they are raising in our great city. And Councilman Emerson, we just thank you for being with us today. Can you begin by telling us a bit about the highlights of your district and the challenges that your residents may face?
Absolutely. Thank you for giving me this opportunity today. Let me adjust my screen there. Yeah, so as you saw from the map, District 4, those of you who don't know what the districts are, District 4 is basically from 21st Street to 45th Street, and then Adams Street to Crocos. So basically the southeast corner of Topeka. And we're lucky that we have Lake Shawnee right on the edge of our district. So it's just a fabulous neighborhood and a lot of great people. And of course, I have to say that Judy Wilson, our own Judy Wilson, is one of my constituents. So it's just a great area, and we have 2 high schools that the kids go to primarily. It's Highland Park High School and then Shawnee Heights High School, and my kids actually have attended. A couple of them already graduated, still have a couple sophomores there. Will be juniors next year at Shawnee Heights High School. But what I'd like to do real quick is, just because Sergeant Burns, I think this was tailored to me, his lesson today, I just wanted to share a quick story of something that happened a number of years ago in District 4 at my house. So one morning, it was probably about 6:30. My wife and I are sitting eating breakfast and waiting for the kids to get up to get ready for school. And a neighbor called, and it's really strange to have a neighbor call you at 6:30 in the morning. But my neighbor said, "Tony, someone's rummaging through your truck." And so I ran outside, and all I had on was my bathrobe. I ran outside barefoot, and sure enough, I saw all these papers strewn. You know, being in construction, I have my office kind of in my truck. But most importantly, and this goes against everything that you just heard, my wallet was in my truck. And I immediately realized, oh my gosh, they stole my wallet. So I don't know if you're really supposed to do this, but it's a real pain in the butt to lose your wallet. All the stuff you have to do. Having 4 kids, I didn't have any cash in there, so it wasn't a cash thing. It was just going to be such a pain to replace things in my wallet. So I got in and chased these these people, and of course had 911 on the line that also as I was driving. And luckily for me, they were horrible drivers because they ran off the road at the first curve we came to. So they got out, and they were pretty young kids, looked like high school age kids. And as they're running away from the truck, I just yelled out, "I just need my wallet." And the guy turned, and one of the kids turned and said, "What's your name?" And later on, we found out they had 7 wallets in there in the truck. I was just the last one they'd stolen. But so the guy got over. He went back to the truck, started looking around. After a minute or so, he came up and he said, I told him my name was Tony Emerson. And he looked and he said, "Well, is it actually Anthony?" I said, "Yes, it's actually Anthony." I guess, we didn't want to return the stolen wallet to the wrong owner. So he gave him my wallet back, and right about then, it was like it was almost, staged for TV. Right about then, the police came from both directions and caught these kids. And they were high school seniors. This was May, and these were high school seniors about ready to graduate. And again, as we found out, they had burglarized. Well, they had 7 wallets, which tells you how prevalent that is. I guess people leaving their wallets in their cars. They also had a couple computers, and they had some radar detectors and other things in the car. But it was. I learned 4 lessons, I guess, that day. And the first was that, as you've already heard today, don't leave valuables in your car at all, especially if it's parked outside, as my truck was. The second thing is, don't get complacent and think it won't happen to you, because it can happen to anyone. As Sergeant Burns said, you leave all the stuff in your car and then it's unlocked and sitting right there. It's a couple of things. A couple of factors are already in place for a crime like that to be committed. And thirdly, that good neighbors are a strong deterrent to crime. And that's why I'm such a fan of what Safe Streets and Judy Wilson does, setting up these neighborhood watches. And interestingly enough, my neighborhood is getting ready to start a watch. It was started last year, and then COVID hit. So all of us are at home 24 hours a day and didn't have to worry about it as much. But we're getting ready to start, and that's not something that I initiated. I must say, one of my neighbors independently got with Judy and started that. So, but I said there were 4 lessons that I learned. The 4th lesson had nothing to do with crime, but has to do with human nature, I guess. About 3 weeks after this occurred, I ran into a neighbor at the store, and they said, "Tony, I heard about all the excitement of your wallet getting stolen and how you caught the guys." And I said, "Yeah." And so I started explaining, telling the story to my neighbor. And I kind of noticed a puzzled look was coming over his face. And I got done, and he said, "Boy, Tony, that's a lot different from what I heard." Ken Darting, who's used to be a basketball coach at Highland Park, now he's out at Shawnee Heights, is one of my neighbors. And he mentioned, "Well, I was talking to Ken Darting, and he said you ran down these guys on foot and tackled them and got your stuff back." And all I could think is, damn it, why did I open my mouth and tell him the story first? That was a much better story. So yeah, my lesson there is let other people tell the story first, and it's probably going to be a lot better story. So that's really all I had today. I don't know, hopefully it's a good illustration of what not to do, but I didn't know if anyone had any questions for me.
Councilman Emerson, have there been any changes in the questions that you've been receiving from your constituents over the past couple of years?
No, I wouldn't say questions. If you're talking about like law enforcement, the number 1 call I get are usually noise complaints. And I'll tell you, that stumps me a lot of times, because the noise can be such a transient thing. It's a car stereo going down 29th Street or California Street, or it's the neighbors who are normally very considerate are blasting their stereo having a party or something. And I will say, I think those things are tough to deal with, because they're either such a transient thing, or they're such a thing I don't know if we want to have police showing up at the doors of anyone that has a party, once in a while. So those are tough things. what I usually tell people when they first call me, and again, and I honestly don't know if this is the right thing to do, but what I generally tell them is hey, are they a good neighbor? You know, go over and talk to them. Don't, you know, I don't know. I'm not a fan, I guess, of if it's a good neighbor, a person you know. I'm not a fan of calling the law first on in that circumstance. So, but those are probably the most prevalent calls I get are noise complaints.
You have a huge district out there, it seems like, and your area bumps right up against the Shawnee fire area.
Mhm.
And a question that just came up in some discussion this morning that we were having was, if you were to get a fire call, wife of a firefighter here, so I guess that kind of is of interest to me. But if you were to get a fire or a police call or emergency call on your district, who would be the first to arrive? Would it be the city? Would it be the county? Or do they all respond together? Just kind of curious how that works.
So my experience is, and I don't know what the official policy is, but my experience is the Topeka Fire Department responds to any fire calls we've got in there. But I've seen both Topeka Police and Shawnee County Sheriff in the area. Now, again, luckily we don't have a lot of crime, you know, in District 4, we really don't. So I don't, it's something I don't have a lot of experience with. You know, we don't, it's a rare thing when we see a sheriff's car or a police car responding with sirens, you know, in our neighborhood. Usually it's, I see one or the other driving through. But again, with respect to fire, the only fire engines I've ever seen are from the Topeka Fire Department.
Super. Anyone else have any questions for Councilman Emerson? I know he has somewhere he needs to head off to. He's a very busy man. Well, thank you, Mr. Emerson, for being with us today. We appreciate it. Your story was great to listen to, and it's always nice to hear those stories that are what really happens, and it makes it more relatable for the rest of us. So thanks for being with us, and we truly appreciate your time.
Yeah, thank you, and thanks for everything you guys do. Thanks.
Thank you. We are super fortunate today because we have a panel of guests that are with us, and it has been really interesting just hearing about some of the conversations that have taken place with these gentlemen and having some of them myself. A big part of what we do at Safe Streets and at Prevention and Resiliency Services is really targeted towards grants. And one of our grants is aligned with opioid use in our city and county. And opioid use has really risen over the past couple of years across the United States, and Kansas is no exception to that. In fact, our county is in the top 3, ranks 3rd for the state in the number of overdose deaths across our state. So we are talking today with a few first responders who experience calls to overdoses and drug use and that type of thing on a pretty regular occurrence. And I'm excited to have them with us. We have Mr. Huber from AMR, Lieutenant Monosmith from Topeka Police Department, and Chief of EMS Siegel from Topeka Fire Department. I am going to pose a few questions to them, and please be thinking of if you might have questions for them as well. And you can either enter those in the chat or raise your hand to ask them when we get through the questions that we already have arranged. So Chief Siegel, I'd like to start with you. What are you experiencing regarding overdoses in Topeka and Shawnee County in your position?
Yeah, so first off, I want to start off with a thank you for having us here today. And so to Mandy and Judy and all the other colleagues that I see on the line here, thank you for having us here. Yeah, from my role, so I look at it from the training perspective. I look at it from the quality assurance, I see along those lines there. I follow the data trends and working with the team there at PARS there on the grant side of it. I think the key thing here is it's in your guys' name in terms of the prevention side of it. You know, prevention is always worth that pound of cure there. We see some of those national trends. I think what's unique from our perspective is we see it from that emergent side. So those, when that person has overdosed, that we're there and get them into that emergency side of the system there, interacting and working with, making certain that the scene is safe through the law enforcement side, securing any evidence, things along those parts there. And then the transfer of care off to AMR for transport ultimately to the hospital. So I kind of see myself kind of wedged in the middle of it along those lines there and participate more from that emergent view as opposed to the recovery side of it.
Okay. Lieutenant Monismith, what are your folks seeing from the police vantage point, and what changes have you seen over the past few years?
Again, like Richard said, for having me and appreciate you putting us on the panel here. We are seeing some overdoses that we deal with in our investigation. I'm in charge of the narcotics section. And one of the things we see is we've actually seen a greater need for us to communicate also internally, but externally. So making sure we build those relationships with external agencies, not just enforcement, but other areas of prevention, and then also internally so that we're capturing exactly what we're seeing. Sometimes there's some misinformation as far as how some of the overdoses are laid out. So we want to capture what we're doing. And then how do we fold that into our investigations? We're as equally concerned as Richard talked about prevention. If we have folks that we come into contact with, being able to find resources for them, not always using the enforcement action. And then also trying to discover the source of we're seeing some of the narcotics transferring around is really our key. We do come into contact with a lot of users, and there's the addiction is very strong, especially with the opiates. But finding the source is really one of our focuses, and that requires us to not only go a little more in depth, not just the surface level there. And hopefully by doing that, we do find a way to prevent some of these overdoses before they happen.
Thank you. Mr. Huber, you guys have probably a very critical role in getting some of those people that are in crisis back to functioning. What do you observe from your perspective?
Good afternoon. Like Chief Siegel just started off this conversation, we deal with it mainly on the emergent end. We have very, very little to do with prevention end, and I think that's where you're going to get the biggest bang for the buck. A lot of the people that we're dealing with start off as legal users. They're injured. They get prescribed a narcotic painkiller, and then it becomes a lifestyle. And so I think that there's two things that we can do to affect change, and that's not going to come from EMS or fire. Number one is the prevention side of it, and number two is once we're getting them to the hospital, is tying them in with some of those social services that they need there to redirect them towards a recovery.
What do you gentlemen think is the most important for a member of the public to know when they encounter someone who may be experiencing an overdose, and what should they do if they see someone they believe is experiencing an overdose?
I'll jump in first and let the obviously call 911 is the key thing. They need to be aware of some of the signs and symptoms. Obviously, if someone's unresponsive, not breathing normally, those are the critical things. Access that 911 system early there so that we can get the proper care and treatment to them as soon as possible. That's probably number one from it. Watching for those, and I always, this addiction is unique, and I've done some research and I've heard a lot of good speakers on it and let them tell their personal stories and testimonies on it. Be aware of that. If you have elderly family members, be aware of their medications that they're on. If they are on any of the the pain control medicines, just being observant of that, because we know it that some of these people never intended to become addicts. It's just that's the nature of that particular drug. And so understanding maybe changes in behavior, watching those prescriptions, are people showing up at their house asking for, just kind of some of the things that Councilman Emerson also said with it there as well, of just kind of being aware of what's going on. Those are probably the two things. So 911 and kind of just watching for some of those changes would be the two things I'd submit to it.
What behaviors or physical signs might we see if we're seeing someone that's experiencing an overdose? Maybe that's Mr. Huber.
So, sorry, I had to unmute real fast.
Okay.
So narcotics, they act on the part of the brain that really controls breathing, right? So that's when we see somebody that's unresponsive due to a narcotic overdose, some form of heroin or oxycodone, morphine, that kind of thing. They're going to go through a stage where their level of consciousness goes down, their respiratory rate goes down, and they really get into extremis when their respiratory rate goes down to the point where they can't support life. So if you see somebody that's got really shallow breathing, really slow breathing, that has had exposure to a narcotic, that's what you're looking for. So for us, the primary thing is to get them breathing normally. We're either going to breathe for them via a bag valve mask, or we're going to give them the Narcan, which counteracts that. So those are the two things. Watch for the respiratory rate, because that's going to drive everything else.
And what, gentlemen, would you say are some impacts that opioid use demonstrates throughout our community?
And just to segue on the disposal piece real quick, we do have bins at the MedSafe bins at the law enforcement center here that we encourage anybody that has expired prescriptions or prescriptions that they're not using anymore and they wish to dispose of. They can do that down here 24 hours a day. And that was put out in our recent newsletter that our PIO put out yesterday, describing that we collect those here and then we dispose of them in a safe manner so they're not just laying around loose, as Chief Siegel kind of promoted as far as people using them. As far as the effects, we see once the first responders come in and stabilize the victims, we really see the holistic impact that it does, not only on the person there itself, but also the family. We see a lot of these opiate overdoses occur in front of small children. We also see it happen in front of or in conjunction with spouses. We see them like Mr. Huber talked about the shallow breathing. A lot of the calls I've seen, they're very not in good shape, as you see at the scene. They do put they use some Narcan maybe on them. And by the time they get to the hospital, they're actually up on their feet, ready to leave the hospital and then go back to whatever lifestyle that they're leading. So we see, I guess, we're seeing from not only a law enforcement standpoint is the impact on the addiction of that lifestyle, where you have the money that we're spending daily on the drugs, we're not working anywhere. And then we have to reach out for other avenues as far as earning income to support those lifestyles. And what we see with the heroin and what we understand from some of our folks that we come into contact with, much different than meth, the heroin, the big fear is really, or the opiate, is that being sick from not using it. So there's a much greater desire impact to continue that addiction. And that affects the kids and the lifestyle. And it's really, it's not just that individual. So that's why we dig into these investigations, trying to find that source. And then lastly, I would just encourage family members. The family members, they see this stuff and they have contact with them, reach out to law enforcement. We're not looking to have anybody get in trouble for being a user, but we are trying to disrupt the flow of that narcotic or that behavior so that we mitigate some of that impact. Reach out to us, ask questions. If there is an overdose, help us out with who these folks are connected with so that we can kind of look at that. A lot of folks think we're just trying to get folks in trouble, and there are laws against drug use, but we're really looking to disrupt that impact the drugs are having in that community.
And Lieutenant Montesmith, you and I have spoken a bit about some recent trends that are happening in our community. Can you just speak to those briefly?
We do see, one of the things that we have seen is where narcotics are being, fentanyl is in the community and it is experienced. So like if you do have contact with needles or pipes in a house, be careful with touching any of those because that fentanyl does have different effects on different people. And we're also seeing where some of the prescriptions are being pill pressed maybe into look like regular narcotics. So there's real narcotics that are prescribed for people and then some fake ones out there that can be much different than what they are actually made of. And touching those can be lethal to some folks. And there's a couple photos I provided, Mandy. If you look at the photos there, the pills there. So the real ones with the M's in the 30s, we see those with an oxycodone or I think it's called a Percocet. And then with the Xanax bars too on the right, very similar. And unless you know what you're looking for, but if you look at the real ones, they're very clear signs as far as how they're pressed. And then you look at some of these other ones that are much bluer and maybe the lines aren't as straight. Basically, you can kind of tell the difference on those sometimes. So those are kind of some of the recent trends we're seeing with that. And then as far as the heroin goes, we're seeing that folks are mixing it with other substances and they're unaware of what they're really getting. And that's what they're telling us is that they weren't, these are some experienced, and it's kind of, it's serious stuff, but you were talking about people using drugs, which goes against kind of what we do in public service sometimes. But there's a lot to gain from talking to them. And they're talking about using, very experienced folks using a certain narcotic and some of them off guard because there are other things in that narcotic. And so what we see sometimes if like the EMS gets there right away, we get some investigators to the scene that we can gain some information during that short window where victims or family are willing to talk. But other than that, the circles of friends that they keep are very small and very, very tight. They don't let a lot of strangers in there. So it's hard to get information out of them because they need that narcotic daily to survive. And with heroin, you just need a very, very small amount, unlike some other narcotics. So.
Thank you so much for all of that. Are there any final thoughts that any of you would like to just share with those participating today or who might be with us later on City Floor?
Yeah, I would just jump in again and just, again, being aware, one of the more interesting things, and Charles can jump in on it as well there, we see, at least from ours, it's not necessarily the young person doing this. This is that 50, 60, 70-year-old person who they had an injury, they were prescribed, the addiction occurs. And so just recognizing some of the signs, if they seem off, something doesn't seem right there, especially towards the end of the month, if that prescription's wearing off, they're literally going through withdrawals. And that might be one of the reasons they're actually calling 911 along those lines. And I think most importantly, just accessing the community system. I mean, we have those resources. So it's kind of the see something, say something type of deal. If they don't feel comfortable talking to a family member, reach out to PD, reach out to the fire or AMR. Any one of us can steer them towards the path of saying, here's some additional resources. The team at PARS and some of the other professionals that we have in town are really good and want to try to sincerely get these people the help that they need. Like I said, this is one I just have a lot of empathy for these people because a lot of them never chose this path. They just went down it and purely out of unintended consequences. So that'd be the one thing I'd encourage. Just be aware of it. Yeah, it's okay to ask. I think that's the key part there and getting it. And then again, if a family member's passed away or something along those lines, getting those prescriptions, anything left over, getting those properly disposed there using PD's Dropbox and anything else there is also really important as well.
I would just emphasize there's a couple of resources that we have available here at PARS, and we do have the brochure in the back also available in Spanish, and we are happy to share those with anyone in the community who would be interested in those. They can just contact us. through our website or via email, any of us. This small package that you see right there is pretty slick. You just dump this and add some water to a prescription medication, and it dissolves and it helps get rid of it. If you're not able to take it to the police department, that you need to dispose of it properly. So we just really encourage that you're aware of what's in your medicine cabinet and make sure that you are getting those taken care of so that they don't end up in the wrong hands. Gentlemen, I just thank you all for what you do every day. I know that it is not easy at all, and your commitment is really something that doesn't go unnoticed amongst our community. Anyone else on the call that might have a question for these gentlemen? Michelle.
Well, first of all, I want to thank all of you for participating in the panel and providing such good information. I do have a question is, are you seeing a change in the age range of people that are experiencing overdoses, or what are you seeing right now? I'm curious about that.
I kind of, like Chief Siegel alluded to, it's of all ages right now. It's not just young. We see young kids that are taking drugs or prescriptions out of either parents or grandparents' medical cabinets, but we also see, like I said, all to the 50, 60, 70-year-old guys using some of the opiates as well.
Other questions? Okay, thank you, gentlemen, for joining us. I really appreciate the information. I know I learned a lot, and I'm sure that our viewers will as well. Thank you.
Well, thank you for joining us today. You will receive a YouTube link for our meeting today and also a survey in just a few days. I really would appreciate it if you would complete the survey and let us know some subjects that you would like to be covered during the Safe Streets Coalition meeting. We do have a few suggestions and we'll be working on those, but we're always glad to know what you would like to be covered for the meeting. So if you would, again, complete the survey, we'd be happy to receive that and receive the information. We do look forward, of course, to our next Safe Streets Coalition meeting on Wednesday, July the 7th at noon. Again, thank you for joining us, and this concludes our meeting. Thanks so much.